The South African Medical Association is investigating medical interns who are apparently swapping positions for payment. It says this practice is unethical, unfair, and goes against the grain of what the medical profession stands for. Now, weekend newspapers reported medical students were willing to pay up to 100,000 rand for internships at preferred hospitals across the country. Let's get more details from Angelique Coetzee. She's the national chairperson of the South African Medical Association. Angelique, thanks for your time. We appreciate it. The Weekend Argus breaking this story, of course, this weekend. Just tell us what you know so far about how this is unfolding.
So we also only became aware of this over the weekend when the media started to ask us questions on this. And as far as we know, that it's not been proven yet that we from SAMA side, we ask our members for proof so that we can start investigation of these cases. We also released a whistleblower website number, so it's whistleblower@srmedical.org, so that anyone who knows about this, please, the real facts, because we need to have the real facts. So for us to be able to investigate this, and you know, so far we haven't got really proof of monetary value being paid. But again, it's not to say if we don't have the proof that it is not happening. It can. Last year it was the same problem. We were alerted last year that there is a bidding process going on. We then also said it is unethical and it should not happen. But this year it seems that there is much more rumors, and we are unfortunately not in a position to give any names or to know. And as I've said, if it's a whistleblower doctor, we will protect that doctor's anonymity as much as we can. Yeah. But we need the facts, because it's not acceptable.
So first, explain to us how students and how their placement is decided upon and by whom, because if there's a process for that, then surely there can't just be a direct swap, can there?
Yeah, so first of all, the interns or the prospective interns are giving a list of hospitals, and they can choose their 5 top hospitals that they would like to go to. Then when the placement comes out, the placement is done by an electronic program. It's not done by someone sitting and deciding where you're going to go to. So it's been processed by an IT system. And as far as we know, that this year, 68% of interns got their first or second choice, which they would like to go to or which they have applied for. Now, we also know from past experience that there will be some doctors that got their placements but want to swap the placement. Let's say they want to go to hospital B, yeah, and they've got a friend or they know of someone at hospital C, then that person wants to go to B, so they will just swap, and that's fine. That you can swap. There's no problem. We don't have a problem with that. The problem is once if you are selling your internship allocation to the highest bidder, that is a problem, and it should not be allowed. According to us, the alleged selling of this placement, it's a form of corruption, and it's unethical, and the play field is not fair. It means that if you are in a financial position to pay for a placement, that you can then get that placement. Yeah. So far, there's only 116, if I'm not mistaken, 116, I'm talking under correction, of doctors that has not been placed yet, of interns. They still need to be placed, and we have been given the assurance that they will be placed before the end of, before the end of December.
Okay.
There is a meeting with the minister as well. And we hope that that placement will actually be the end of this month, then after the meeting with the minister. So we're waiting for that, for the outcomes.
Yeah, thank you for that. I'll let you answer your call. Appreciate it. Angelique Coetzee, National Chairperson of the South African Medical Association.